conventional care right now is if you're anxious, we're going to give you SSRIs, which mute and numb you to a degree where you can function better. So we manage your misery. We don't cure you. We don't transform you. We don't address root causes. And you're going to be on SSRIs for a year, 5 years, 10 years, indefinitely. And we're not going to tell you about the problems getting off the SSRIs, the withdrawal issues, et cetera, or the sexual side effects, et cetera, or the black box warning for suicide, suicidal ideation. This is a different model of care. It's a different paradigm. It's limited doses, transformation, and long-term sustained benefit.
Hey friends, this is Dr. Lisa Marie Bobby, and you're listening to Love, Happiness, and Success for Therapists, the show that is all about helping the helpers. And I'm glad you're here today because today we're talking about something that is, I think, pretty interesting and really on the cutting edge of our field, which is psychedelic-assisted therapy. And I know that many of you are curious about this. There's definitely buzz. You might not know a ton about it, but we're going to change that today with our very special guest, Dr. Scott Shannon, who is a trailblazing psychiatrist who has led a number of clinical trials and one of the largest integrative clinics in the US, including creating a new model for psilocybin intensives. Welcome, Dr. Shannon.
Hi, Lisa. Happy to be here. Happy to join you.
Wonderful. Well, I mean, we have a lot to unpack, and I did a little sampler of some of your professional background and the things that you've been up to. But maybe we could just start there by telling our friends who are here with us a little bit more about yourself and your work, your mission.
Well, I guess I've been on this path to transform mental health care because, in my experience, it was lacking in many ways. I got inspired as a medical student working under Andrew Weil, who was part of the original sort of explosion of research at Harvard. And he did some of the first double-blind studies with cannabis while a medical student at Harvard. I encountered him in the 1970s, and he really inspired me to get involved with psychedelic care, specifically MDMA, which was legal at the time. And so I practiced in the early 80s working with MDMA to support couples in psychotherapy and a general sort of accelerant for psychotherapy. MDMA was then scheduled in 85, and it became much more difficult to do any work in the psychedelic arena. So I got involved in integrative pathways. I trained in acupuncture, homeopathy, and Jungian psychotherapy, and really went on to do my training in psychiatry and child psychiatry, cross-cultural psychiatry at the University of New Mexico, and then came up to Colorado, where I've been for 35 years. And so over the last 15 years, we've had a clinic called Wholeness Center, where we've been trying to do innovative work with mental health care in the sort of holistic, integrative model where we work with diet, nutrition, supplements. We do brain mapping, QEEGs, neurofeedback. And over the last 10 years, we've been working with ketamine-assisted therapy and psychedelic research, first with MDMA, then with LSD and 5-MeO-DMT. And recently, our research has been around ketamine, group ketamine for professional burnout with frontline healthcare workers, first responders, firefighters, paramedics, and policemen. And so that's been some of our thrust. And as I was telling you earlier, the frontier our clinic is on now is we've been moving from a cash model into an insurance model to see if we can improve access and broaden our base of support. But we've got about 15 providers at our clinic in northern Colorado, Fort Collins. And we just love to innovate. And that's really the passion that drives me.
Yeah, that's amazing. Well, we have so many different things to dig into. But before we do, can I just ask a hopefully not too personal curiosity question? As you were kind of coming up in the field and I'm guessing learning about more conventional types of mental health treatment, I guess, what did you learn about what was possible with psychedelics compared to the outcomes that you saw as being possible for psychotherapy, more conventional pharmaceuticals that made you think, this is where I want to go. This is where the cutting edge is. This is the opportunity. What was the difference that you saw?
I think what I saw was just the transformational nature of psychedelic care. And I mean, watched a lot of people who had been in couples counseling for years, long time, still struggling in relationships. And to watch an MDMA session really transform that relationship and started on a healing path. But also working with people with MDMA who'd been in psychotherapy, even psychoanalysis for years and felt stuck. And really to have a transformational process where it just opened up. And I think also just my own personal experience and my own personal growth that happened with agents like LSD helping to move me, further along the path of healing and sort of personal connection and insight. And I just saw that the tools we were working with in psychiatry were not curing anyone, they were managing people's misery, and they were often laden with dramatic side effects and daily dosing. And I was really interested in a model of transformative care that helps people to find root causes of what's keeping them stuck and helping them launch a sort of personal path of discovery, spiritual growth, and increased relational happiness. And so, to my mind, they represent the next frontier in mental health. And I think their research bears that out.
I can't wait to hear more about your research studies. And I'm curious though. So, my professional background, I'm dually licensed. I'm a psychologist, but I'm also a marriage and family therapist. And I think in many ways, that's where my heart is. I really enjoy couples counseling, and I can relate to what you're saying. And I think many of our listeners right now can, around working, especially with couples who are so darn entrenched in some of these dynamics, and it's difficult to move. And I'm just wondering what you believe to be the difference. So, a couple who is experiencing the work with a benefit of something like MDMA, what's going on inside of either of them that makes it more flexible, I guess
Well,
you could say, or more receptive to what it is that you're trying to do?
my experience, and this is whether you're working with people with severe complex PTSD, as we did in our phase 2 and phase 3 FDA studies, or you're working with a marital couple who've, done some psychotherapy, but have been just struggling with each other for years, sometimes decades. And the same thing happens to people in the process with MDMA, because with MDMA, people feel safe, profoundly safe, interpersonally, emotionally safe. They feel, um, this doesn't happen with psychedelics because MDMA is not a psychedelic agent. Um, but really, what it does is it helps people feel so safe they don't have to hold on to their baggage, their resentments, their bias, their defensiveness, the whole sort of layering of armoring that we have when we are in relationships, from prior wounding and low self-esteem and all these pieces that just sort of fall away. And at least in our studies, people feel safe enough to deal with their traumatic history right on directly. And they can deal with it, integrate it, digest it, and move on. And, we sometimes see that with EMDR or some of the trauma based therapies, but it's so painful and so difficult. And so many people drop out of the trauma based psychotherapies because they are so painful and challenging, because they're forced to re experience and reprocess. But when this happens with MDMA, they come from a place of safety and profound personal comfort that allows them to see whether they're working relationally with their spouse or whether they're working with a past trauma that was inflicted by a parent or a assailant. They can just see, well, this is the way it is. And they come at it in a place of comfort, balance, and security that allows them to move on. And so, like with couples, it allows them to relate to each other with the affection that they have without the baggage getting in the way. And I mean, in some ways, MDMA could be best characterized as a non-specific accelerant of psychotherapy because of this capacity to make people feel safe and to get people past their defense mechanisms. And people would say, well, is it the kind of safety where people feel like they can jump off a building and fly? And no, it's not like that at all. People on MDMA will commonly tell me, I have never felt so much myself as I do right now. And what happens when people can peel away those defensive structures, the ego structures that we have, what happens is they just start to radiate love, because that's what's within us. That's what drives us to connect. That's what drives us in relationship. And when people can come from that place of love and affection without baggage, yeah, I found, and this was back in the day, I had done an internship, but I had not done my psychiatric training yet. I was working as a GP. And when I get married couples together and give them MDMA, I looked like I knew what I was doing, because they would do the work together and they would make all these breakthroughs. And it was just beautiful. And I mostly just created a container for them and got out of the way. Sometimes I have to structure things a little bit, but it's really that phenomenal. Now, working with complex trauma and PTSD is another level. And often what we saw is that in our research, the phase 2 and phase 3 protocols, people would have 3 prep sessions, a session with either placebo or medicine, 3 integration sessions, a month apart, another medicine session or experimental session, more integration sessions. And so they'd have 3 sessions where they either got placebo or medication, and they were a month apart, and they would typically last 6 to 8 hours long with the medicine. And in those settings, what we found, interestingly, people would come to us with an index trauma that might have been a rape or a battlefield combat experience or something else that was horrific from their adult life. And almost inevitably, without fail, when they got into the session, their first session would talk about their childhood traumas, because these were foundational for them. And often those we would get out of the way in the first session, and then the second session might begin to address their index traumas, their adult traumas. But it's just very interesting how, for most of the people dealing with complex, severe PTSD, almost all the people we encountered had encountered childhood physical, sexual, or emotional abuse. If we got somebody into the study who had a single incident trauma, no pre-existing child trauma, these people did very well with 3 sessions. But when we saw people who had this layered like effect that we see in real life, I mean, so many people experience childhood trauma, that we found that we had to peel the onion in layers. And the first layer is often childhood, early childhood, under 10 type trauma. And then we would get to older and older levels of trauma.
Wow.
So it's just a pretty amazing tool, and very different in ways from the classic psychedelics like psilocybin or LSD or even 5-MeO DMT. Those work very differently. But I will say, maybe just trying to create a framework for your audience about what is psychedelic psychotherapy and how does MDMA relate to psilocybin, relate to ketamine, relate to DMT. I think the useful way when I'm teaching and training about it is there's 3 components that make up the psychedelic medicine framework. The first is the container, which is really something that most psychotherapists understand. It's the relationship, it's safety, it's rapport, it's connection, it's trust. That needs to be built, and that is challenged in ways with psychedelic medicine even more deeply than it is in conventional psychotherapy. So the container, the next is the catalyst, and this is the medicine agent, anything that changes consciousness and awareness in a really distinctive, definitive way. They don't have to share any biochemical mechanism. So MDMA has no relationship to psilocybin, which has no relationship to ketamine, which has no relationship to nitrous oxide. all these different agents, all they do is they change awareness, they change our consciousness internally that allow us to access different information, different memories, different points of view and perspectives. And so that is the catalyst. And it doesn't even have to be a medication. For example, holotropic breath work uses guided hyperventilation to do the same thing. And we could look at other things. For example, fasting may do some of the same things. It's tough for people to go on a 30-day fast, but it definitely changes your awareness. Mm. And then finally is the carrier. These are the headphones, the eye shades, the music that drives the experience inside. Because if someone is on psilocybin and they're out wandering in nature, they may be just completely entranced by nature, but they may not go in and deal with their traumas or their personal history. So the three elements are the container, the psychotherapeutic container, the carrier, which is the agent that we work with, and the carrier, which drives it inside and makes it therapeutic.
Mm-hmm. Yeah, got it. And I hope this is okay to say. I'm sitting here thinking, the ravers were right back in the day. But also, what you're talking about is perhaps why somebody just taking these substances and going to a music festival, it isn't the same thing. Because when you are doing this therapeutically, that there are very prescriptive things that are happening, that you're curating the experience that is intended to have a healing outcome. And I think that this is actually important to talk about, because one of the reasons that I wanted to invite you on is that I think that many more conventionally practicing therapists, understand, like have heard the buzz, right? That psychedelic therapy is a thing, but really don't know a lot about how it works. And I think that there's a lot of misinformation about what it is. And so you and I are both in Colorado. And what I unfortunately have heard quite a lot about are people who don't have nearly the training, the background, the experience, the basis for doing what you do, but are facilitating these experiences for people that are more recreational in nature, and then passing them off as being treatment. And I'm wondering if you could speak a little bit to what you've heard, because I feel like that needs to be cleared up, because what you're telling me is that there is a powerful basis for this, that it is very useful and important, and the potential for it to help so many more people than conventional methods alone. You're right. I mean, a lot of people, they do get stuck in this, and it's very hard to reach them, even through therapy. Like, it's immense and it needs to be brought out into the light, but that there are these barriers that may be caused by the brand, for lack of a better word, some of the misconceptions. Can you speak to any of that?
Yeah, I definitely can, Lisa. I think one of the things that's useful to understand is that we're having a psychedelic moment in our society right now. And psychedelics are happening in many ways and many pathways in many places. And, from states like Texas, a very conservative state, passing a $50 million Ibogaine initiative, to places like states or many different cities around the country. I think 30 different cities have decriminalized psychedelics. 2 states have legalized psychedelics, Oregon and Colorado. So to try to frame that in the biggest way possible, I think there are 4 different pathways moving at the same time for psychedelics. And the first one that I'll talk about is religious freedom. So there are now, I think 30 churches, psychedelic churches in Austin, Texas. There's probably 20 in Denver. Any big city around the country has now an enormous amount. A friend of mine, Joe Tafur, who's a family physician, just sued the DEA for his Church of the Eagle and the Condor, which is an ayahuasca serving church. And he just won. And so now the DEA is allowing him to practice the religion of the eagle and the condor with ayahuasca for a psychotherapeutic spiritual growth practice. So what we're going to see over the next 30 years is psychedelic churches popping up everywhere, and whether they're delivering the sacrament of psilocybin or ayahuasca or ibogaine or DMT, but these are focused on religious freedom. They don't tend to have a lot of medical screening. It's about
Hmm.
spiritual growth. The access is wide open. The costs tend to be low, but supervision, structure, and safety may be more variable.
Yeah.
So that's religious freedom. The next pathway that's happening around the country is underground work. And what we see, for example, in Colorado is about probably 70 to 80% of the psilocybin that's being delivered is by therapists who are working underground. They're
Hmm.
not licensed to deliver psilocybin, but because psilocybin is legal in Colorado and Oregon, therapists are doing it sort of undercover without paying the licensing fees, without going through all the training. They may be very, very good therapists. They may be doing excellent work. But there are also people that are just hanging out a shingle who have no training and who don't have a healthcare license. And it's underground work, and it's happening all over the country, not just in Colorado and Oregon. But this is a phenomena where psychotherapists say, I have a friend that can get me magic mushrooms. I think I'm going to start using it with my patients. I'm going to charge them for it, but it's underground, and it's like, don't ask, don't tell. And, it's kind of on the, on the sly. And then you have legalization, which has happened in Colorado and Oregon. There's a regulated program, it's licensed. There's a training requirement for people to go through. It's 150 hours of didactics. It's a 40-hour practicum, real live experience delivering psychedelics. And then it's 40 hours of consultation. This is being run by Dora, who holds your license and mine
Excellent.
as licensed healthcare providers. And you have to get licensed as a healing center, which we just did at our clinic, Wholeness, in Fort Collins. It took about 4 or 5 months. There's a lot of regulation, there's a lot of cost, it's cumbersome, but we're now delivering that care legally in a regulated way in the state of Colorado. And finally, there's medicalization. And medicalization is when there's FDA approval of these agents. MDMA, psilocybin, LSD, 5-MeO DMT are all in phase 3 FDA trials. So once they get all the data they need, they go to the FDA, they ask for approval. MDMA went last summer, it was denied, but that is circling back around. We can talk about that. But basically, when that happens, physicians like myself will be able to write a prescription and prescribe psilocybin, LSD, MDMA. It's probably going to have rules called REMS that are built around it by the FDA, but it will be able to be delivered in a clinic or in a hospital and be able to be reimbursed by insurance. So I'm participating in the legalization regulated model now, but really my eyes are on the medicalization piece because that allows us to include insurance and bring 150 million people into this conversation. And, likely your aunt or uncle or conservative neighbor are not going to go underground and take psilocybin in someone's basement. They're going to want to do it in a doctor's office. But I think each of these four pathways moving forward offers different people what they're looking for in a different target population.
Hmm. That's really good to know. I think I'm maybe learning right alongside my listeners. I'm a stand-in for my listeners in case you haven't figured that out by now. But this is really good to know, and particularly about the training process and the regulatory efforts that are coming up around it. Because I was speaking with a psychologist friend not too long ago about the training process of psychedelic assisted therapy, and what she brought back is like, it's just a bunch of people getting high together. Like, that is the training. It's stuff that she has encountered. And so what we're talking about right now is the fact that I don't know, might be happening in certain circles, but that when people are doing it well and with excellence and with integrity, there's actually quite an involved process and also quite a bit of regulation around it. And I think that's a good thing,
Mm-hmm.
because Another point that was raised was related to the ethics and the risk factors of psychedelic assisted therapy if you have somebody who is ingesting this medicine and for a period of time very vulnerable while they are in this altered state, and then to be in a little room with a practitioner who is not regulated, maybe not trained, like that could go sideways in a lot of different ways. And so the fact that there is more regulation and training around this, I think, is certainly a comfort to me. And I think that that's going to go a long way in having it be more widely accepted by the more conventional therapeutic community, especially if it's supported by some of the research that you've been
Yeah.
conducting.
No,
So I'm glad
I
to hear
agree with
this.
you. I
Yeah.
agree with you. I think there is high levels of vulnerability and
Mhm.
suggestibility.
Yeah.
So the likelihood of boundaries being crossed is higher, more challenging. I think it's more, people are more vulnerable in many different ways in a psychedelic session. So I think the ethics need to be, in some ways, a step beyond what we're used to in conventional psychotherapy and healthcare. And it's it really requires a high level of, I think, ethical groundedness, because it's very easy to become ethically ungrounded as a practitioner in this work, because it
What
can,
do you mean? Yeah.
because I think it can stroke your ego, because people are vulnerable, people are suggestible, and if they get massive positive benefit while going inside with psychedelics, they link that to you and think that you are their savior. Um, and these things happen with psychedelics. People go
Mhm.
through and have a mystical experience,
Yeah.
and they're transformed by it. And the research really documents that when you go through and have a mystical experience, the benefits are durable. They show up 6 months later, 12 months later from a single experience. And so I think the challenge as a provider is not to get your ego caught up in it, and to remain humble and recognizing that the healing is not coming from you. It's coming from the person within themselves who's on the journey. And we're there as a midwife, as a support, as a facilitator, as a guide, but we're not doing the healing. And so it's very tempting to get your ego caught up in this work.
Mm. Yeah, I could see that. Thank you for saying all that out loud. I think it's important to recognize, and that this work requires, if anything, more nuance, more expertise, more boundaries, more humility, because of what you're doing. Like it just the way that you talk about it, it sounds very powerful on many levels, and that power needs to be respected, um, but also by therapists who are involved.
Yeah.
So let's talk a little bit more about the research. So you and your clinic, you have done, I think you said something like 10 original research studies, and I'm sure you're also knowledgeable of many other research centers who are contributing to the literature these days. And I'm just so curious to know, um, what have you been doing, and also, like, what are you finding? We certainly talked, anecdotally about some of the magic that can happen, but where's the research showing?
I think the biggest difference in the research between conventional agents and psychedelic agents, and I'm speaking broadly, including MDMA, which is really more of an empathogen than a psychedelic. Yeah, some people will say enactogen, but basically finding the God within, finding the heart within, heart opening. There are a lot of different terms, but MDMA is not a psychedelic because you're not having visual distortions or perceptual changes. You're you're just having a profound sense of calm. And basically, when you get rid of your neurotic defenses, which we all carry, then what's left is your heart and a sense of love and affection and appreciation. And so the common response to people when they go through these experiences is, my heart feels so open, I feel so loving, I feel so connected, and they want to drop back into that. And so that's the challenge with this, because unfortunately psychedelic experiences, empathogenic experiences end, and people have to, The big challenge with psychedelic medicine is how do we integrate these experiences into your real life and create behavioral lasting change?
Gosh, you know what I'm thinking about right now? I had the great privilege of interviewing Dr. Dick Schwartz not too long ago on IFS and his model,
Mm-hmm.
and what you were just talking about, this like core experience of love, like when everything else drops away. It's making me think of his model, the IFS, and the different personalities and parts that can become, wounded or firefighters or defenders or exiles, and that how your core self really is always perfect and loving and whole, and nothing can ever change that, but that it becomes obscured with all of these different things, and that what you're saying is that by the use of these tools, really, people can experience that part of themselves. But then the challenge is how to maintain that in a sustainable way
Right.
after the treatment experience is over. And I have to tell you, and this is not to throw shade on anybody, but I was telling you before we started recording this, I've done like, I felt like very I don't know if protective of this topic is the right word, but um, wanting to be careful about what information I support in going out there. And so, like, I've done like pre-interviews with a number of different people who have reputations as also being influential in this field, and I have felt so concerned by some of the stories that I've heard. People doing retreats in Costa Rica with no pre-care, no pre-treatment, not a lot of screening, just like come with me into the jungle and we're going to do a lot of hallucinogens, and the person facilitating this is also partaking. And then when I ask questions about like, and so what is the follow-up plan, there really isn't one. And not to say that the experience itself can't still be valuable, I'm sure that it can. But I'm very relieved to hear you talking about what this process really needs to be in order to have the not just maximum impact, but to really accomplish the mission, which is sustained reduction in symptoms and distress, and maybe even sustained, positive benefits from this. So I just wanted to reflect that back to you, that I have heard stories of not everybody doing it this way. So this is
Yeah,
good, but
I
I'd
think
love to
we
hear more. Yeah.
I think we need to have real caution about this. We've been delivering
Yeah.
personal growth retreats in Costa Rica for about 4 years. I think there are 80 psychedelic retreat centers in Costa Rica right now.
Mm-hmm. And
And
nothing
ours,
about Costa Rica. It's great.
no,
Yeah.
I think ours use a framework where people have a psychiatric eval before they go down. People have a visit with a psychotherapist before they go down. They're going down with trained licensed psychotherapist, and they're not taking substances, and they're integrated into an entire container of change and transformation. And then
Yeah.
they have integration processes that continue after they return from Costa Rica. So there's a way to do it well, and I think there's a way to do it poorly.
So when you guide people through these experiences, and they do have all of the different elements of change and healing, what are some of the things that you have documented?
Well, we've been typically in these studies, the large studies, the FDA approved studies, they're sponsored trials. We're one of 10 or 15 different sites around the country, sometimes around the world, who are doing this research. Then all the data is collated, and then it's submitted both for publication and to the FDA. And there have been four different research sets that have been submitted to the FDA that have been awarded breakthrough therapy status by the FDA. Breakthrough therapy. That means it is head and shoulders above existing levels of care and treatment. And I've been involved in two of those. Our clinic has one with MDMA and one with LSD for generalized anxiety disorder. So I think the thing that's most surprising about it is the changes are durable. The changes come from one or two or occasionally three different interventions with these medicines. And people often continue to improve after the therapy stops. So I tell people what we saw with MDMA is people continued to digest their trauma. Once they've been able to get in and actually process and face their trauma really intimately, fully, without horror and terror and the cycle of trauma being set off again, is that they continue to digest this over time. And this is the way that most of us heal from trauma. You and I, we may have a near miss in a traffic accident on the way to work, and it frightens us. We're a little bit off for a day, but then we digest it, we process it, we move on, and within a few months, it's not even there anymore, really. We can remember it, but it's not traumatizing to us. And I think many of us have encountered big T trauma in our lives, things that are really difficult and painful. And we encounter them, we deal with them, they're difficult, we go through a stress reaction, but over time we digest it and we move on. That's the human capacity to heal. Unfortunately, when people are set up perhaps by childhood trauma, perhaps by other things, depression, substance abuse, they get overwhelmed with trauma and they get locked into a place where they're not able to gain on it. They're stuck, and they're stuck in a trauma cycle, a horror, PTSD cycle that is just unrelenting and very, very painful. And so what we see with these agents is they can help to break people out of those cycles and begin the natural process of healing. We support that. We're there as a guide and a support, but the medicine just facilitates a normal process. And what we see over time is people continue to digest their trauma, people continue to improve their self-esteem, people continue to reduce their anxiety. And when we do these studies, if we look out at 3 months, at 6 months, or 12 months, we see that people's benefits sustain. Like when we did the LSD trial, I said, LSD for people with generalized anxiety disorder. That doesn't seem like a very good fit to me. And so I was betting when we signed up for that study, I think this is not going to pan out to be a useful treatment. I was wrong. In our study, this was all the other sites combined, just got published in April, submitted to the FDA, was awarded breakthrough therapy status because people with a single dose, and this was a 5-arm study, so they could either get placebo, 25 mics, 50 micrograms, 100 micrograms, or 200 micrograms of LSD. It's a 12-hour day. It's a long day. It's pretty intense. And technically, we weren't supposed to be doing psychotherapy because the manufacturers, the sponsors, wanted to have it as a model of psychological support. So we could be there, we could be comforting, but we weren't supposed to really process in a very classical sense, psychotherapeutically, what went on. But the results show that a month later, from one dose, people were better. And the 100 and 200 microgram dose showed sustained relief. And they ultimately decided to pursue the 100 microgram study. And that's what's in the phase 3 now with the FDA trials. So I think for me, this shows really a different model of healing than conventional care. Conventional care right now is if you're anxious, we're going to give you SSRIs, which mute and numb you to a degree where you can function better. So we manage your misery. We don't cure you. We don't transform you. We don't address root causes. And you're going to be on SSRIs for a year, 5 years, 10 years, indefinitely. And we're not going to tell you about the problems getting off the SSRIs, the withdrawal issues, et cetera, or the sexual side effects, et cetera, or the black box warning for suicide, suicidal ideation. So I think what strikes me the most is this is a different model of care. It's a different paradigm. It's limited doses, transformation, and long-term sustained benefit.
Wow. Okay, so just curiosity question. So the way you described the power of MDMA really is this deeply felt sense of safety and ability to connect with the work. LSD, though, I'm guessing, is not that. And I have heard this said, and I'd be curious to know your thoughts about this, that um, some suspect the active ingredient, so to speak, is a spiritual experience. That when somebody almost experiences the divine, so maybe it's not the love drug of MDMA, but like kind of feels like contact with God is what
Yes.
is helping people. Has that been your experience, or would you
The
characterize
research
that differently?
shows, and I think
Mhm.
that probably about 70-80% of the research corroborates that the degree of improvement and the degree of sustained improvement relate to the degree of mystical experience the person has, not the
Hmm.
intensity of the psychedelic experience. So people have a mystical experience. And the way I reframe what a mystical experience is I think it's something that creates a metaphysical shift for people. They see their reality in a different way. We've been raised in this very limited, reductionistic, materialistic framework that is not the long standing path of humanity. And basically, what this framework does is it really restricts our ability to have a spiritual perspective or to understand how we're connected to other people or to nature or to our own spiritual self. And when people go through LSD, 5-MeO, psilocybin, and have a mystical experience, it shifts their metaphysical framework. It shifts it away from reductionism and materialism towards something else. And there's a whole range of different things that it shifts towards. But basically, all those perspectives hold a much broader, more balanced framework of our reality that leaves itself open to other paths of connection and belief. And
Mm.
and when someone has that, it changes them indefinitely.
Yeah.
I can say that I had a mystical experience in 1983 in a cove in a California beach, and it stays with me. It has helped me to be less afraid of dying, to be more in touch with my passions and my gifts and my calling, and to be more driven to share my affection and appreciation for other people, and also in ways more driven to share this this path of healing that I
Yeah.
think opens itself up for people to have spiritual growth and transformation. So
Mm.
that's why I think these changes are durable, because people have an experience of reality that is different than what we've been taught to believe.
Wow. That's beautiful. Thank you so much for sharing your story, but also that perspective. That is very inspiring. And I mean, what you're talking about, I think, is what a lot of therapists are really trying to do with their clients through
Mhm.
more conventional therapeutic techniques. I mean, like the deeper meaning of the work, like that is the outcome that we all want for our clients and for ourselves. And to think that there's a pathway to helping people achieve that more directly than the tools that we've had in our tool bag. Um, that's really inspiring stuff. Oh, I have so many more questions for you, but I want to be sensitive to your time. I feel okay. Well, okay. Before we start to wrap up, just very briefly, what are your thoughts about cannabis? Because I have, from what I've seen in research, a little bit of a mixed bag. There are benefits that are true. Sleep disorders, appetite, pain, so on and so forth, but also other research that suggests that if you are resolving some problems, you might be creating new ones with cannabis. Has that been your experience, or do you see it differently? I'm so curious just to hear your perspective. I mean, you're just so knowledgeable in all the research in this landscape.
My framework about substances in general is
Hmm.
there's no good drugs and bad drugs. There's good relationship and bad relationship with different agents.
Yeah.
And I think you have to know yourself, and you have to know what creates balance and what creates imbalance and what creates patterns of use that are destructive or maladaptive.
Mm.
So that being said, I'm I appreciate cannabis in many ways, but I've not yet seen a framework for cannabis that strikes me as therapeutic. I've talked to practitioners who believe it. The research that I've seen is not convincing to my eye. I don't think of them as a psychedelic agent. I do think they could have value for some people in some frameworks, but it's not something that I recommend. It's not something that I use. I've found great value in CBD for anxiety, stress response, even PTSD, and we've published on it. Um, but
Yeah.
for THC itself and THC containing cannabis, I'm I'm open-minded, but at this point, I would have to say that I'm skeptical.
Thank you for sharing that perspective. I was just curious what you would say about that. Oh my goodness. This has been such an interesting conversation. Um, and so as we wrap up, I guess I would love to hear your thoughts, so therapists listening to this conversation and feeling similarly inspired and thinking, you know what, this would be a fantastic way for me to develop my abilities to help more people. It might be meaningful to them personally and professionally. Where would you suggest that they go to begin learning more about how to potentially incorporate this in their own practice, get the training? Maybe we could just start there. But I think that there's also maybe a subsection of our friends with us who are like, I don't know if I personally need to facilitate that, but might want to refer clients. Can you talk a little bit about some of those
Training
resources?
opportunities.
Yeah.
Yeah. About 6 years ago, our clinic spun off a nonprofit called the Psychedelic Research and Training Institute. And
Mm.
we're really focused on bringing an introduction to ketamine assisted psychotherapy, psychedelic assisted psychotherapy. We have 4-day trainings in the Loveland area. We're going to be doing some in other locations as well. But it's really an experiential. You get to sit with ketamine and sit for people experiencing ketamine, but also to experience ketamine in an IM form and a sublingual form as part of the training. So 4 days, sort of a combination of didactic lectures and personal experience and small group work. That is, I think, a good introduction if someone is saying, well, I don't know if I want to spend $10,000 or $20,000 training in this and committing my career to it, but I
Oh,
want to get a taste of what it's really like. I think
yeah.
Prati, Prati, pratigroup.org is a good introduction to it. I'm one of the faculty members. I helped found it 6 years ago, and it really the responses we get and the feedback we get from our practitioners, and we train psychotherapists, nurse practitioners, psychiatrists, psychologists, a whole broad range of and often primary care folks too as well. Nurses and primary care docs often come in for the training. So that's a level of training that I think is a good introduction. And we do have an end of life training as part of that, but we often
Mm.
recommend that people go through the first tier before they jump into that.
Yeah.
There are probably at least 10 different programs that train people for the psilocybin regulated model in Colorado. And we're a practicum site at our clinic, at Wholeness in Fort Collins, for Fluence, which is one of the large umbrella organizations. So people that get their 150 hours of didactics through Fluence can come to us and experience psychedelic care with psilocybin in our clinic, working with our practitioners in the care of actual patients.
Mm.
Other practicums, you're going off and treating your peers who go in a retreat model, and you're sitting with, your neighbor who practices psychotherapy or a psychiatrist from across the country, but you're not providing clinical care to symptomatic patients. And we really feel like that's a step up. We're trying to work towards a 2-year fellowship in psychedelic medicine, which will be residential on site for people. And that's a next step for us. We hope to launch that in the next year or so. Other training programs. So I think you can look up the Colorado. If you go to the DORA site, they list all the regulated, approved training programs and compare and contrast them. There's many of them out there. There's at least that many in Oregon as well.
Mm.
So those are good places to start, I think, if you're interested in this model. And I think if you're interested in referring patients and want to be involved in watching a patient go through this care, we do week-long intensives at our clinic called the Sequence, where people get ketamine on Monday, psilocybin on Wednesday, and then ketamine on Friday as sort of embedded in pre-care prep sessions, intensive care while they're on site, and then aftercare once they leave. And I'm actually in the middle of one right now. I'm theoretically retired, but periodically I get called back to do these because I love
Yeah.
transformational work and it really speaks to me.
Yeah, I could see how it would be very meaningful to be part of. Okay, well, lots of resources and training opportunities, and thank you for sharing all of that. And I guess one last question. So if I were to hand you the magic wand and ask you, I mean, if you could have this evolve any way that you wanted to, how would you like the future of our shared profession to be informed or influenced by, what sounds like you've been working your whole life to bring into the conversation and the room, the treatment room?
I guess if I could have one wish, I'd love to see MDMA approved as an FDA approved medication next year and that we could work with it clinically because I think when people see what it's like to do psychotherapy with MDMA versus conventional psychotherapy without, I think we're going to have a lot of people quickly convert to doing assisted psychotherapy. There are
Mm.
risks, there are drawbacks, there are costs. It's intensive, it's expensive, and it's probably not an introductory level. But for chronic issues, severe, even there's research coming out now about personality disorders. And I think
Hmm.
it begins to just show you that this is another way to think about care and treatment. So I would really love to have MDMA transform the practice of psychotherapy and psychotherapy assisted medicine because I think it's really a very good entree into psychedelic medicine, which can be opaque at times, challenging. Um,
Hmm.
I sat with a patient yesterday for 8 hours in a very challenging psilocybin session, and it's like, if I was a conventional psychotherapist, I don't know how I would have dealt with that. But
I could see
uh,
that. I could see it being, I don't know, scary is the right word. I mean, you know what you're doing, but that's a kind of
it's
inducing a
unpredictable.
psychotic episode.
You
Yeah.
have to really be, as a child psychiatrist, I'm used to play therapy and dealing with kids who are innately
Yeah.
unpredictable. But I think I love that element of it, that
Yeah.
you have to be ready for what comes.
Wow. A science and an art. I love it. Well, thank you so much for spending this time with me today and for sharing your wisdom and your perspective and your knowledge with me and also our listeners. I feel like this is really a vanguard, a growth edge of our profession that's so important. And it's been wonderful to learn more about it from you. Thank you so much.
My pleasure, Lisa. I've enjoyed chatting with you today.
Thank you. Okay, you guys. So that is Dr. Scott Shannon, who has so much to offer. You can learn about his training opportunities. Start with his website, wholeness.com. And then I'll also include links to all the resources that he shared, including the prattigroup.org, maybe links to some research studies on the article that will go along with this podcast. Thank you so much for joining the conversation today. And I'll be back in touch with you soon.